Hi everyone, I'm Dr. Lynn Wagner and this is Doc's Thoughts. So I'm currently 2 days post-op from having a big ovarian cyst removed and my ovary. I had a 13 centimeter cyst that I felt about a month ago. I went through a little bit of a panic thinking it was something else, but ultimately it turned out to just be a simple cyst. And so they took it out a couple days ago, and I wanted to share with you what I did pre and post-op to help my body heal as rapidly as possible. I'm obviously still tired, I'm recuperating, but I feel that these things have helped me be stronger and get through it faster. This is not direct medical advice for any of you. Obviously, if you're having a procedure or surgery, you need to talk to your doctor and your surgeon about what you take before and after. That's very important. But these are some things you might want to discuss with them because they can be very helpful as you go through the healing journey. The other thing about these things is a lot of them can be used even if you're not having surgery. You know, we all go through different stressors. Surgery is obviously like a big stressor on the body, but we all go through varying levels of stressors every day. So some of these things are just things you can do on a daily basis to help keep your body resilient and strong. So as always, leading up to the surgery, and this is what everyone should be doing anyway, I focused really heavily on getting enough sleep. So I made sure I was getting, 7 to 8 hours of sleep, of good quality sleep a night. I tried to minimize my stress. That's obviously not always easy, but I tried to minimize stress as much as possible and just kind of said no to any extra obligations that I didn't need to take care of at that time. I tried to eat really, really healthy. So a lot of us might want to go into that comfort mode where you want to eat comfort food because you're like, oh, I'm going to be sick. Maybe I'll eat that comfort food, but I really, really tried to focus on fresh vegetables, fruit, healthy meats, good quality protein, fats, and all those good healthy foods. And I exercised regularly. So I didn't overdo it. I didn't go and run, 10 miles or do anything aggressive, but I took nice walks and I tried to do my strength training, a little bit less than normal, but I just tried to keep my physical fitness up because I knew that I'd be laid up for a while after. So those are some basic things that really any of us should be doing on a daily basis anyway. The other thing I did leading up to it, which is getting a little bit more into the supplements and the medicines, is I took some specific things. So I'm a big fan of collagen. We use Trinont at the clinic. I also like Vital Proteins, which is the powder. I just don't like the powder, how it clumps up so much, so I tend to go with the liquid. I take Trinont regularly, but I doubled up on that leading up to the surgery. I took L-glutamine powder, and again, this is actually something I take every day. I think it's really good for your gut. I think it's a really important amino acid. Also really good for healing pre and post-op. So I took extra doses of that before surgery. I took that twice a day before surgery. And then I actually got a kickstart on a little bit of magnesium because I knew that things might get backed up. And so I tried to start taking a little bit of extra magnesium. The last thing I did, and again, this is a medicine, so you need to talk to your doctor about it or come see someone like us, is I actually took a peptide called BPC. So peptides are chains of amino acids. They're prescription drugs. They're a little bit more non-traditional, and it's actually an injection. So I was giving myself BPC injections leading up to the surgery to help my tissue heal. And again, I didn't take this right before the surgery because you're not supposed to take certain things before you have your surgery, but I was doing this a little bit in advance, trying to get my body ready. And then that leads to post-op. So after recovery, after I get out of the surgery, a lot of these things I'm just continuing. So the glutamine I continue, the collagen I continue, the magnesium I continue, and then, just some other simple things. Obviously, guys, I didn't think I was gonna need pain meds, and I actually told my surgeon that. When I came out of the OR, I was like, can I actually have a prescription for those pain meds? So I'm taking narcotics, or I'm not taking them anymore, but I took them for the 24 hours after the surgery, and they helped a lot with sleep and pain control. But then you're gonna get blocked up. So whether you take Colace or whether you take something like X-Lax, it's really important that you stay on top of it because if you're post-op and you start to get backed up and you just let it go, it can get worse and worse, and then it's really hard to get things undone, if you know what I'm saying. So not to get too graphic, but those are some of the things that I've done and I'm doing pre and post-op. The BPC I'll continue for another couple weeks post-op as my tissues repair and heal. And as I said, obviously I'm still tired, I'm still recuperating. I don't expect myself to bounce back and be 100% right away, but those are some of the things that have really helped, I feel, make my experience better. And then lastly, a couple things I added in that I didn't talk about yet, but I think are really important, is I've been doing breath work. So I've talked about breath work in previous Doc's Thoughts, and I'll talk about it again. I'm actually taking a breath work class where we work on things like diaphragmatic breathing, the 4-7-8 breath, box breathing, all things to kind of calm down your nervous system. And I felt that was very powerful for me, even getting wheeled into the OR when I may have felt kind of stressed out. And I've been doing some cold water experiences. So I've been turning my shower cold at the end of my shower just to kind of also give myself that therapeutic benefit of the cold experience, which I will talk about in another video. So That's what I have to say about my surgical experience. I'm healing well, and I thank you for all of your support and love that you've given me as I've gone through this, and I will talk to you guys again soon.